In order to achieve the appropriate level of mental health care for students, the United States must understand, be aware, and spread knowledge about the need of mental health care. So, what is mental illness? Mental illness is a disorder of the brain, whether that be biological, environmental, social, or cultural factors. It affects how we think, feel, and act. Mental illness can range from anxiety, depression, bipolar disorder, eating disorders, PTSD, OCD, ADD, ADHD, schizophrenia, and much more. Here are some mental health statistics. 1 in 5 Americans struggle with their mental health. 450 million people are affected by their mental health. Out of those 450 million people, only 50 million people are receiving treatment, leaving 400 million people unaccounted for. Mental disorders are the leading cause of ill health and disability worldwide. Only 51% of youth ages 6 through 17 get treatment for their mental health conditions. For individuals ranging from 10 to 34 years of age, suicide is the second leading cause of death. So in the United States, suicide is the 10th leading cause for death for individuals. The overall suicide rate has increased 31% since 2001. 46% of people who die by suicide have a diagnosed mental health condition by a professional. 90% of people who die by suicide have experienced symptoms of a mental health condition. Leaving us with lastly, 54% of people who die by suicide have not received help from a professional. This can be due to the fact that from the World Health Organization, stigma, discrimination, and neglect prevent care and treatment from reaching people with mental disorders. Due to that fact, people are judgmental and hypocritical towards individuals with a mental illness, and so therefore they are afraid to get treatment or help by a professional. So what can we do as a community? There are several solutions that would help to decrease the number of people with mental illness who are left untreated. 1, it is important for low-income families to have access to health care. This will allow people of all socioeconomic backgrounds to seek treatment from a psychiatrist. 2, it is important to change the view that society has on mental illness. Acceptance of mental health will encourage people to seek help without feeling ashamed. And 3, it is necessary to take time to talk to someone about these issues before the situation becomes worse. Talking to your family members or friend is comforting, and receiving help will eventually lead to the next step. So a big thing about that one is a lot of people try to bottle up their emotions inside, and that leads to more symptoms of depression and anxiety, and can further lead to other serious symptoms, including as far as up to suicide. So talking to someone will really help push someone to go seek treatment. Mental health is an important issue for all educators, which gets me to the main point of this topic. With that being said, educators and professionals have recognized the impact that mental health has on students' learning and achievement. So you may ask, why is it important to have mental health awareness in schools? First, we need to understand the impact. Underlying the seriousness is the fact that 60% of high school students that struggle with mental illness do not end up graduating from school. With that, New York mental health experts recognize the problem. With that earlier intervention could result in a more positive outcome for high school students. In July of 2018, New York was the first state in the nation to require mental health education for all students. This program is called the School of Mental Health, also known as the SMH. The SMH does the following. First, it offers support and service throughout every grade level. 2, assesses mental health needs of students. 3, provides access to behavioral and mental health programs. And 4, helps build relationships between the school, students, family, and the community. A statement from the New York School of Mental Health says, "Our program is to promote healthy, social, emotional, and behavioral developments of students and break down barriers to learning, so the general well-being of students, families, and school staff can be enhanced in collaboration with other comprehensive student support and services. It is important that we spread awareness across the nation. Mental health awareness programs are not mandatory for all schools, but until then, teachers and administrators can work to promote awareness with their students." A key element to shine a light on include the concept of self-care and responsibility for one's own mental health and wellness, with an emphasis on the fact that mental health is an important part of an individual's health. Teachers and students should be provided with ways to recognize signs of developing mental health problems. And some of these developing mental health problems you can find all over the internet. They're under a lot of psychological websites, such as the World Health Organization, and you can find those online very easily. Educators should also address the relationship between mental health, substance abuse, and other negative coping behaviors, as well as the negative impact of stigma and cultural attitudes towards mental illness. Because teens spend most of their day at school, it just makes the most sense to have mental health awareness and education become their curriculum. When you empower students with a proper understanding and knowledge and encourage dialogue, students will be able to get the help that they properly need. By providing students with a mental health program or curriculum in a school setting, this will provide a safety net for the children, their families, the school, and the community.